After your spinal cord injury, there may be changes to the way your urinary system works. Your injury and current ability to move and feel will have an effect on the choices you make with managing your bladder. No matter where you are in your healing, learning about your body and the different tools needed to urinate will help you make the correct decisions to maintain a healthy bladder. In this video, we will discuss the different bladder management options you have to help you decide which will work best for you. It is important to know that neither of these options will cause any permanent changes to your bladder. If you no longer need to use them, they can be stopped. Let's start with a catheter. A catheter is a thin tube that is inserted into the bladder through the urethra to drain urine. When you use a catheter to urinate, it is called catheterization. There are two types of catheterization: indwelling and intermittent. When a catheter is inserted into the bladder for longer periods of time, it's called an indwelling catheter. This catheter is kept in place by inflating a small balloon to keep it from slipping out and allowing for continuous drainage into a collection bag. There are two types of indwelling catheters: urethral and suprapubic. The major difference between the two is where they enter the body. A urethral catheter gets its name because it goes into the bladder through the urethra. It then stays in place until it is no longer needed. Every 30 days, it will need to be replaced with a new catheter. A suprapubic catheter goes into the bladder through a small opening in the lower abdomen. Suprapubic means above the pubic bone. This catheter needs to be changed every 30 days as well. Having a catheter in your bladder all the time puts you at a higher risk for urinary tract infections, bladder stones, and bladder cancer. It is important to drink plenty of water, usually 2 to 3 liters every day, or the amount that your physician has recommended you should drink. Talk to your healthcare team about other risks and benefits of indwelling catheters. Intermittent catheterization, also called IC, is performed several times a day. Like indwelling catheterization, this process requires the catheter to be inserted into the bladder through the urethra. For a male, the urethral opening is at the tip of the penis. For a female, the opening is right above or in front of the vagina. Once inserted, urine flows through the tube into a bag, toilet, or other container. When urine is done draining, the catheter is removed. This is then repeated every 4 to 6 hours, maybe more often, depending on how much you have had to drink, because you may not know that your bladder is full. It's important to monitor your time and how much you drink. Typically, a bladder holds between 400 and 500 milliliters of urine, or about 2 cups. Normally, your bladder does not hold more than 400 milliliters without sending a signal letting you know it's getting too full. Since it may no longer send this signal, a full bladder may cause urine to back up into the kidneys and can lead to kidney failure or even death. So, your goal should be to empty less than 500 milliliters of urine every time you catheterize. There are many catheters to choose from. Some are soft, curved, pre-lubricated, silicone, or latex. Some come with bags, and some come in discreet packaging. Intermittent catheterization works well for people who can still remove clothing, position themselves, and handle the catheter in their fingers and hands. If a person can't perform these things, then an attendant or family member will have to help. There are benefits to intermittent catheterization over having an indwelling catheter. Studies have shown that intermittent catheterization, when done correctly, decreases risk of urinary tract infections, developing bladder stones, and bladder cancer. Talk to your healthcare team about other risks and benefits with intermittent catheterization, or if there are other options that would be right for you. It's important to remember that one of the main goals of rehabilitation is to help people return to daily life. it's possible to live a full life, including work, school, and social activities.